Assalamualaikum. Welcome to my channel Pharmacology Made Easy. Today we will discuss about routes of administration of the drug, and if we get sometimes, then we will discuss about drug absorption. So at first, routes of administration of the drug. There are different types of routes of administration of the drug, and in pharmacological language, we can classify the routes of administration of drug into enteral route, parenteral route, and miscellaneous route. Enteral route. Enteral means hollow organ. The drugs which are getting or pass through into the GI system or gastrointestinal tract, then we call this enteral route. What is parenteral route? Par means beside, and enteral, the word comes from enteron. Enteron means intestine. The drug which bypass the gastrointestinal tract is called parenteral route. Sometimes it is confined to the injection injectable forms of drug that we given in our body through different kinds of route is now confined into parenteral route. And another route is miscellaneous. Miscellaneous route, if we define the miscellaneous route have some local and systemic effect of the drug also. So that's why it is called miscellaneous route. So enteral route are classified into oral route, buccal route, sublingual, and rectal. So at first, oral route. Oral route, there are different of drugs we can give through orally. We can give tablet form of drug, we can give syrup form of drug, we can give suspension. Sometimes we can give a breakdown injection into the oral route also. So what are the drugs we can give in orally? We can give the example of different drugs we can give orally. The drugs are tablet paracetamol, capsule pantoprazole, capsule omeprazole, capsule cefixime, syrup ceftriaxone, syrup cefixime, আর হচ্ছে syrup paracetamol. uh, these are the examples of oral route. So what is the importance of oral route? First, it is a more common route. It is convenient, it is cheap, it is more safe, and any kind of person can give drug or taken the drug orally. These are the importance of oral route. Another important importance of oral route, self administration is possible. So the importance are, this route is more most commonest route according to the route of administration of the drug. It is more reliable, it is convenient to patient, it is safe, and self administration is possible. The disadvantage of oral route is large volume of drugs cannot be given, irritant drug cannot be given, and it has a it is a variable bioavailability due to fast metabolism. So oral route, the drugs which we given through orally has less bioavailability. Second, the second important enteral route is sublingual route. Certain drugs we can give in sublingual route, such as nitroglycerin, isosorbate mononitrate, isosorbate dinitrate. These are the drugs we can give sublingually. The importance of sublingual route: the drugs are absorbed through lingual vein. The drug absorbed into the lingual vein and goes into the systemic circulation. So it is the most important thing of sublingual route is rapid onset of action. We can we can increase the duration of action of the drug, and the bioavailability is so high in sublingual route, and we can bypass the fast pass metabolism by using sublingual route. What are what are the disadvantages of sublingual route? Irritant drug cannot be given. Sometimes drug may split out from orally, if the drug makes irritation. Sometimes these drugs without saliva goes into swallowing. So these are the problems of sublingual route. uh, these are the two important route we have to know in pharmacology in enteral route. One is oral, one is sublingual. If we say buccal is the point that is between the gum and cheek, and we can give different types of drugs. Buccal is such as glucose. We can use adrenaline. We can use vitamin C. We can use ascorbic acid. These are the drugs we can give in buccally. Uh, there is also a chance of variable viability if we choose buccal route. So it is a less important route, and nothing important in it. Another route of another route of enteral route is rectal route. We can give suppository in rectal route. We can give paracetamol suppository. We can give diazepam suppositories in rectal route. Rectal route, the importance of rectal route, the absorption is variable. It can bypass the fast pass metabolism. We can use it as an emergency route. It is the route. The disadvantage is that it is not convenient to all. Self administration not possible, and it is a route of irritation. And sometimes the drug, if we administer drug there, that will be painful for a patient. And sometimes any uh, mm, sometimes by choosing this route that is uncomfortable to the patient. uh, but how can we bypass the phosphate metabolism through rectal route? If we say if we know the pectinate line, above the pectinate line, the rectum is supplied by the superficial rectal vein, and below the pectinate line it is supplied by the middle and inferior rectal vein. This middle and inferior rectal vein drains into hypogastric vein, and this vein drain into the inferior vena cava, and this inferior cava drains into the heart. So if we give rectal suppository, this drug goes into the uh, lower rectum, and this drug is absorbed, and we can easily bypass the fast pass metabolism. But if we give the drugs in upper rectum, what will be happen? The superficial rectal vein, which is drained into the superior mesenteric vein, this superior mesenteric vein and splenic vein form the portal vein. This portal vein drains into the liver, and where the metabolism of the drug occurs. So that's why if we give the drug in upper rectum, that will be more biotransformed or more metabolized. So these drugs cannot be absorbed easily. Importance of rectal route, the absorption is it can act as an emergency route. It can the absorption is variable. The absorption is slow. The absorption is maybe incomplete, but we can avoid the fast pass metabolism, and we can choose as an emergency route. But the disadvantages are it is uncomfortable route. It is not a convenient route. Patient may feel pain during the giving drug through this route. Okay, now the parental route. There are some much more routes that relies on parental route. These are intradermal route, subcutaneous route, intrathecal route, EP, epidural route, then intravenous route, intraarterial route, subcutaneous route, then intraarterial route, intraarticular route, intrathecal route. These are the important parental route. So first, intravenous route. What is the importance of intravenous route? Intravenous route, it is the route of emergency. First thing. Second thing, it is the the bioavailability of this route is 100%. Drug does not absorb here. Drug goes through into the systemic circulation, and drug goes. If we choose this route, it is a rapid onset of action, by bypass the first pass metabolism, and the route of emergency. And the disadvantages are, self administration is not possible. Skilled hand must be needed to give drugs through this route. So doctors, the skilled person are doctors, nurses, brothers and sisters can give the drug through this route. Sometimes this route may be painful. If there is inflammation to the vein, there will be thrombophlebitis. Sometimes abscess may also occur there, and strict aseptic measure must be needed, or there will be a chance of infection in this route, and this chance of infection may leads to thrombophlebitis. Sometimes any microorganism enters into our body and turns into the sepsis. So it is the important route. What are the drugs can you give in intravenous route? The drugs can you give in intravenous route? It is injection, ceftriaxone, injection meropenem, injection nitroglycerin, injection adrenaline. We can give through this route. Injection adenosine we can give in this route. So these are the important drug that we given in intravenous route. Intramuscular route, the bioavailability is variable, and rapid onset of action, and sometimes if we choose more drugs, we can give intramuscularly. And it also about the fast pass metabolism. The disadvantage of this intramuscular route is, it is painful, self administration is not possible, and sometimes abscess may occur during giving different kinds of drug in intramuscular route. What are the drugs we can give in intramuscular route? We can give. Thank you. The next video is next.